Can you imagine a decade, a year, or even a day without NACHC? For over 40 years, NACHC has been dedicated to supporting America's community health centers and the millions of people they serve across the country. Born from the 1960s war on poverty, the first health centers are founded in Boston, Massachusetts, and Mound Bayou, Mississippi. This marks the beginning of a movement that provides quality, affordable, and accessible health care for millions of underserved and uninsured. Shortly thereafter, the National Association of Neighborhood Health Centers, later known as the National Association of Community Health Centers, is established to provide education, training, and technical assistance for health center staff and community board members. Although health centers soon grow to serve millions of people, the subsequent decades bring significant challenges and serious threats to the community health center program. The first of which occurs just one decade later. In the 1980s, NACHC leads a massive effort to protect health centers from the Reagan Block Grants Initiative. After surviving the greatest threat in health centers' brief history, the 1990s bring the Bush administration's health center expansion, ultimately increasing federal funding for the health center program. This is one of the many achievements for NACHC and the health center community. Health centers reach the significant milestones of serving 12 million patients and surpassing $1 billion in health center funding. Obstacles arise again in 2000, with a proposed phase-out of Medicaid FQHC payments. This threat is quickly extinguished by NACHC and its supporters. Soon after, the REACH initiative to double health center funding in 5 years is supported by over 60% of Congress. By 2004, health centers serve 15 million patients and reach $1.6 billion in funding, a 60% increase from 2000. Then in 2009, $2 billion in funding comes from the American Recovery and Reinvestment Act. Over the next decade, NACHC leads the Access for All America campaign to strengthen, grow, and expand health centers. As a result of a tremendous grassroots campaign led by NACHC, the Affordable Care Act passes and allocates $11 billion to health centers to expand the Community Health Center program, with the goal of serving 40 million patients by 2015. Could you imagine a decade, a year, or even a day without NACHC? Without NACHC's hard work and collaboration with the health center community, what would the implications be today? What if there wasn't the annual funding and appropriations to strengthen, grow, and expand health centers? Visit www.nachc.com and join today.